We're going to now move to Ryan, who has been a strong advocate and a public spokesperson, who will also show a little bit of a video and describe a little bit of his journey through his use of cannabis, his medical story, as well as how he works with the system to try to inform people well. Ryan, thanks.
Thank you. That video is just one of hundreds of stories I have within my medical journey, and with its main focus on quality and safety, as you can see in healthcare. But it features the stigma of medical use of marijuana and how it almost cost me my life. What did they miss? Well, in addition to talking to me, they were given my in case of emergency sheet, which highlighted the severe ankylosing spondylitis, which is inflammatory spinal arthritis, with my spine fused except for some in the neck. Severe osteoporosis, subject to fractures, severe Crohn's. Then they went through all my medications, and what I didn't know until I got to the hospital is I had a 2x4 rug burn on my forehead where the contact point was with the floor. Based on the pain medication I was taking at the time, there was absolutely no way I could experience a 9 or 10 pain unless there was something seriously wrong. The paramedics in this instance arrived before the firefighters. The annoyed medic that didn't like the marijuana sent them away even before the assessment was complete because there was nothing seriously wrong. After the assessment, they didn't even think they should take me to the hospital, and I said, I absolutely have to go. There's way too much pain. And so they're like, well, can you get up and walk out? I said, I just came to when you walked in the room. I tried to get up, I can't move. So he said, if we help you get up and hold you as you walk down the hall, will you try? So I said, sure. Once in the ambulance, I had to demand a towel or a pillow or a collar as we turned a corner because the pain just became unbearable. And like I said, they take me to the wrong hospital. They realized in the assessment, of course, I can't just get up. They couldn't take me out on the stretcher. And when I got to the first hospital, they told me I had a broken neck, but it wasn't until I got to the foothills and they showed me the x-ray that I realized I'd anatomically cut off my head. It's called the C2, fracture through the base of the dens. It's the hangman's fracture. It's the bone they try to break when they kill you. So 99.9% of the time it's fatal, paralyzed, and so this is a true miracle. I'm walking, talking still. The main pain I'd fought for the decade was in the neck. It had been full tension. Currently, I'll just quickly say 13 diagnosed conditions, 15 medications. It's very difficult. But anyway, I get back from the hospital, and the same thing happened with the marijuana. I'd smoked early in my life to treat the pain. I ripped off a finger at 9. I was diagnosed with my arthritis at 13, and I just ignored it and kept dealing with it until I actually had to. But I get back from the hospital, 2 to 3 nights, I have trouble sleeping in the halo, so I thought I'll smoke and go to sleep because I use it for that. I took 1 puff, 2 puffs, and my body didn't want it, and I couldn't smoke it. It was just like the pain went away, what we were fighting with the opioids and the marijuana, your body doesn't want it. And as I carried on with my pain coming back, I got back to using it again. But there's little doubt anymore about how cannabis can be used to improve many people's medical lives and conditions. Prior to the 90s, as discussed earlier, all research done was to try and prove what harm the drug caused you, and that's all, nothing about the good side. Since then, and I know in Canada we have a thing called CCIC. It's the Canadian Consortium of Investigation of Cannabinoids. It's headed by, I believe, Mark Ware, a pain specialist out of Quebec. And they have a lot of research papers done on how good it is for you medically now. And I suggest some people have a look at that. One of my grandfathers, he had the same spinal condition that I had, deforming and pain. Unfortunately, he treated his with alcohol and suicide at 45. I know for me personally, I've used it to battle with pain since my 20s. I absolutely wanted nothing to do with getting involved with an opiate drug. But my doctor, I'm a very, 35, I was running a very CEO, president of a big business. I had I had my activities. I have 2 kids. I was coaching hockey. I just had a very extremely active lifestyle. And my doctor said you could basically, you cannot take the drugs and live for 20 years with no quality of life, or you can take the drugs and have 10 years of good quality of life. And I chose the 10 and be with my kids. It was about 11 years after I started that I had the fainting from the low blood pressure, broke my neck. So I was actually scheduled to die about then, go down on the drugs. So I say I'm on 2nd round now. And I'm glad I'm here. I guess I got to see a few things in the last few years, that have been great. But living with severe constant pain, 20, 30 years, I got to tell you, it's very hard to fight and keep going. Opioids block pain, whereas cannabis has a more deferring effect of the pain where you don't think about it all the time. I don't believe marijuana is addictive in any way, unlike opiates. And opiates are not addictive if they're taken properly. The key is you have to live in a bit of pain, whether it's 2 weeks of surgery or chronic pain. Is it realistic if you've had major surgery or chronic pain to not have any pain? No. As long as you live in a little bit of pain, your body will not become addicted. I'm proof of it after 11 years of use and being at such a high dose, going down in the 2 days. In 210, I was switching medications, and I asked my doctor, I said, okay, you now give me enough medication that if I gave it to somebody else, they'd die. So what would happen if I woke up tomorrow with no pain on my neck? And he said, if you behaved yourself and you live in a little bit of pain, you'll be able to go off it in days. Otherwise, it'll be like a 6-week nightmare, probably with all the sickness. Similar to opioids, cannabis doesn't get you high in the same manner as when you're using it recreational, if you're using it medicinal. One of my big beefs is people are always comparing alcohol to marijuana, but they are really too different to compare. Alcohol is extremely impairing compared to the marijuana. You experience significant changes to your cognitivity. You can't walk, you can't talk, you can't drive, or think properly. People think they become Superman and can do anything. Worst of all, it often leads to violence. Whether it's fights in bars, streets, domestic violence at home, it wrecks marriages, employment. Using marijuana really relaxes people, calms them down, and they can complete a task at hand or do anything they want. It doesn't have the same type of effect on you. While pending legislation, recreational medical users and legislators need to figure out the driving issue. My experience is that high drivers pay very close attention to driving perfect. Why? They're paranoid. Happens. They think everybody in the road knows they're high, and they don't want to get pulled over, so they drive perfect. Have you ever seen, another cognitive thing, have you ever seen someone really drunk read a book? No. But I can guarantee you have high school students and university students that smoke it so they can study better. So that's a little bit of a weird one. Anyway, laziness, well, if it was me, no. Like I said, I was active in sports. I played every sport till I absolutely couldn't move anymore. I was a president CEO of a very successful business, 29 employees. We were one of the fastest growing companies in Canada, and I raised my kids, coached hockey. It was amazing. It never made me lazy. I still hunt, fish, and shoot as my main 3 hobbies, and I will never give them up for anything. But to give you an idea, a day like today or just one day of my hobbies puts me in bed for 2 days of severe pain, maybe no sleep, no matter what I take. Anyway, we wanted to also discuss stigmas of marijuana, and so I am just going to end my story now, and we'll answer any questions you have regarding my story or talk about stigmas. Thank you very much.